Hey y'all, it is the 13th of August 2011 and I wanted to do a quick update about my chest. I made a 1-year video like 2 months ago when it was actually closer to being 12 months post-op, and I lost that video, so that's why I never posted one. But since then some stuff has happened and I wanted to kind of talk about that, just about some of the negative experiences I've had as far as infection. And basically what happened was, if you look back at my old videos, you'll see that I talked about projection in one of my nipples, and you know, that was exciting and I was hoping it was going to be in another nipple. And about 4 months ago or so I got an infection in my nipple, and I went to a doctor and he cleaned it out and put me on an antibiotic, and I thought that it was cleared up and fixed. And then earlier this week, I got infected again, and rather than paying $200 for the doctor bills, I decided I was going to try and fix it myself and clean it out. And when I did so, I got it all cleaned out, and it turns out that that projection was not a projection. It was all the infection that had just been, or all the buildup that had been there since basically my nipples healed. So that, you know, I kind of struggled post-op with how long to clean my nipples for and how long to leave them bandaged up versus when do I start giving them air. And it was supposed to just be obvious when it got healed, you stop putting the bandages on it, and I never really felt like mine got healed. I was putting bandages on it for like weeks after I was supposed to, and I still didn't feel like it was, you know, it was all gone. So eventually I just stopped, and, you know, it dried out and healed up, and that was that. So, you know, it turns out that it wasn't, I guess, you know, it wasn't a good thing that I stopped, but at the same time it was taking way too long to heal, so I probably should have seen someone way back then. And when I cleaned it out, yeah, it's ridiculous that it was there for that long, and I just had no idea until it built up enough that it started, you know, causing pressure and pain. And I took care of it this time, and I found a hair actually inside of the nipple, and I guess that had been there since, you know, surgery. It may have been that, you know, I don't know the way that the surgery went, but whatever happened, somehow one of my chest hairs got trapped in there, and that's what I assume caused the infection. It was my body fighting against it, because it shouldn't have been in there. So that's kind of just a forewarning, I guess, for guys who are contemplating getting surgery or wondering how the post-care is going to take. You know, ask your surgeon how long it should take before your nipples are healed and before you take the bandages off, and if it seems like your body isn't following that timeline, go see someone rather than dealing with it a year, you know, almost a year and a half later. It wasn't that big of a deal. It was just, you know, dealing with the doctor fees, and then they didn't even get it fixed, and then having to do that all myself. It was a learning experience though. But I will show you guys my chest and how it's healed up. Other than that, everything is really good. I've gained more sensation back, especially in the last 3 months. You know, up until about a year I hadn't gained much back, and that was kind of frustrating. It's very numbing. Like when your arm goes to sleep, you can still feel it obviously, but it's weird to touch, and so I don't like being touched around that area, and I've slowly been able to regain that normal sensation in broader areas than before. So I'm hoping that that's a good sign that maybe eventually I'll gain all of the feeling back, maybe closer to 2 years, I don't know. But anyway, here is my chest. As you can see, this is the nipple that I always talked about before, and there is really no longer a projection there. A tiny bit, but that's right in the middle there is where I had to clean it all out. I know, that's lovely, but yeah, it wasn't meant to be there, so I took care of it. But this is everything else. The scars are really fading even more. I've got whiter area that's going all the way out to here, and on this side the white kind of goes out to here, and a lot of it is being covered up by hair. This is an area that I don't like to touch because that feels weird, but I have feeling all up here and even down to here, and then it kind of like this area is the no-no area. That's the side. You can't even really see it in the video as I'm watching here in the mirror. But yeah, so the scars look great. I just lost the camera. The scars look great. I feel great about it. I go swimming, go to the locker room, everything. I've never been asked anything about it or even looked at funny. I think if anyone thought it looked funny, they wouldn't want to embarrass me and ask about my scars, so nobody gives me a hard time. The only other real update is, well, I finally have enough facial hair growing in that I can actually do something with it, and of course you can't really tell in the video, but I've kind of been letting it grow for like the last 2 or 3 weeks and just shaving this area and under my chin. So I like it, but I need to shave it because I'm going back to work soon. So that's about it. On a personal update, I am applying for grad school this fall, to go next fall, hopefully, to get my master's in student affairs or student college personnel, whatever the school wants to call it. And as I approach my essays, I'm going to contemplate how I incorporate being trans into my essays, because I think that that's a huge part of my college experience, and a lot of what I learned from my transition is what I want to bring to my future work in student affairs. So, you know, it's the debate between remaining stealth and giving my process validity and my knowledge validity in the student affairs in that realm. So I'm trying to decide between those. So I will update everyone as I decide how I'm going to approach it, and yeah, I'll keep you all posted. Thanks.